Hi again. I was going to continue to talk about the COVID vaccine that was just approved by FDA. However, somebody mentioned it to me that they wanted to hear about lung transplantation. Where I live, one of the hospitals here does do lung transplantation for the last few years, and it's somewhat a new field, and people wanted to know about it. So I'm going to try to do a couple of videos on it, but this is my first one, and this is very general, broad understanding. I want to have a disclaimer. I am not an expert in lung transplant. I have referred patient being a pulmonary specialist, and I have some basic understanding of it, but it does not mean I'm an expert. So lung transplantation has been going on for several years, and interestingly enough, in the beginning, people were doing lung transplantation, which is bilateral. That means they did both lungs. Afterwards, a thought process came in that if we do single lung transplant, the surgery is smaller, and then same donor lung could be used for two different people, improving their health. So again, the single lung transplants took over quite a bit. And then again, the study showed that double lung transplant was superior in survival, and subsequently more and more of double lung transplants are done. The common indications are, as you can imagine, whenever somebody can't breathe and has an lung issue, or the shortness of breath and worsening of the lung function is due to, of course, lungs. So the common causes are, of course, smoking-related COPD, emphysema, chronic bronchitis. Cystic fibrosis was another one that they have tried, and usually double lung transplant is needed for that, and people do that for the younger population. But among the older population, COPD and interstitial lung disease, or what is also called pulmonary fibrosis, or idiopathic pulmonary fibrosis, short IPF, was one of the major indicators for the transplant in the last few years. Actually, it, I think, has surpassed more than 50% of the cases, or close to 50% nowadays, that get bilateral lung transplant is for pulmonary fibrosis. A third one is pulmonary hypertension, and some, maybe 5% of the patients that have pulmonary pressure increased, called pulmonary hypertension, get lung transplantation. Please note that in idiopathic pulmonary fibrosis, there are other causes of fibrosis. So idiopathic means we don't know the cause, but there are other causes of fibrosis, and they also are included when I say it's going more than 50% for the lung transplant for the total ones done. So basically, there are various scores that are lung, and there is a system by which the lungs are allotted. The lung allotment system includes certain scores of your shortness of breath, your age, and your pulmonary function studies, need for oxygen, etc. And those scores are good for medical people to determine whether somebody needs or not. Based on those scores, there is an allotment system, and people get lung transplant according to the seriousness or the severity of their disability. So these are certainly not done randomly, but still it comes to a point where there may be somebody who has bad end-stage COPD but doesn't want to do it, or doesn't have a nearby lung transplant center, and so doesn't get evaluated and doesn't get it. On the other hand, there may be another person that they will do it. So I talked about basic indication, so which I told in 4 groups. One is cystic fibrosis for younger group, COPD, emphysema for other group, pulmonary fibrosis, either idiopathic or otherwise, is the third group, and pulmonary hypertension is the fourth one. So those are the 4 groups of people that get or that are considered for transplant. As you can imagine, if they're severe, then they're considered for it. But once I told you about indication, at the same time, I'm going to tell you about contraindication. The contraindications are also very simple to understand. Advanced age. In the past, the cutoff used to be 65. They have extended it on a select group of people that are otherwise healthy to 70s, 71s. I recently had somebody who is 72 that had a bilateral lung transplant within the last 2 months. He had a pulmonary fibrosis. He had a single lung transplant. He had a pulmonary fibrosis. And I had two other groups which were close to 60s or 65 years of age. They had a bilateral for, again, idiopathic pulmonary fibrosis. So these are the three people that I know personally that have recently lung transplant. I had a fourth young guy, mid-50s, who had a bilateral lung transplant for COPD also. So these are the people that get it. But you can imagine now the contraindication. The contraindication is age. If somebody is 80, nobody's going to consider transplant. Somebody who has had a stroke and has not recovered or has a stroke by history would not be considered. Somebody who has a cancer. Now, skin cancer is not a contraindication, but any other cancer, unless you prove that it's a cancer-free, for some people say 2 years, some people like to go for 5 years, they will not be considered. Severe coronary artery disease or weak heart, they would not be considered unless somebody is considering heart-lung, though I would doubt that would be done. The psychological instability is also considered because medications are needed, regular follow-ups are needed, and you don't want to waste a lung if somebody is psychologically sick and could not do the follow-ups. At the same time, also, economic considerations are done. If the insurance would not cover the medications which are used for preventing the rejection, they would also not be considered. Chronic infections which are not controlled. So if somebody has recurring infections, some people have bones, some people have legs, skin, and the main one is Mycobacterium avium or MAC. So if somebody has persistent MAC, which means an atypical tuberculosis in the lung, which does damage the lung significantly, and they could become disabled to be qualified until and unless the infection is well controlled and there is no evidence of active infection, they would not be considered. The family support is another issue. People need intensive follow-ups, a lot of help in the first few months after the transplant. So those who have no family help are sometimes rejected. Kidney disease, another contraindication for the transplant. So if I would say, any organ dysfunction of substantial amount other than lung, you will not be considered. So top to bottom rather. Brain, if somebody has dementia, somebody has stroke, they will not be considered. Heart, somebody has severe coronary artery disease or compromised heart function, they will not be considered. Bad, uncontrolled, chronic infection in the lung, MAC, Mycobacterium avium, they will not be considered. If somebody has a kidney disease, they will not be considered. If somebody has a vascular disease, severe atherosclerosis, aortic aneurysm, they will not be considered. Somebody who is not psychologically stable would not be considered. Somebody who has no family support would not be considered. Somebody who does not have economic support for handling the medication would not be a candidate for it. Just briefly before I go to my next lecture about the survival, the waiting period depends on the center, how aggressive people are, and where your board score is. There is a score which designates the severity of your condition. Based on that, your chance of getting transplant is there. Just to do quickly before I go to the next video, maybe next time, the bilateral lung transplant 5-year survival is about 7.5%. Single lung transplant is about 4.7%. correction, 4.7 years. I probably misspoke. Bilateral, about 7.5 years. Unilateral, about 4.7 years. Thank you for watching. I hope you like this. Subscribe it. And I will talk about the COVID vaccine and the additional part of our lung transplant next time. Thank you. Have a nice day.